Okay, let's do another case. Robert Douglas?
That's me.
Hi, Robert. Come on in. My name's Paul. I'm one of the nurses. Why don't you have a seat? I'm going to ask you a couple questions about what brought you in here today.
Okay.
So what's going on? What brought you in here?
Oh, just feeling weak. Have no energy. Had trouble getting out of bed this morning.
Okay. When did all this start?
Last night. I was supposed to go to dialysis this morning, but I just didn't have any energy.
Okay, so you were feeling fine yesterday, and today you're feeling really weak.
Yes.
Okay. I'm going to go ahead and get your blood pressure. How old are you, Robert?
62.
Okay. Are you having any pain or problems breathing with this?
No, just feeling dizzy.
Okay, so you're feeling dizzy. Do you have a list of medications that you take?
Yes.
I think it might be right there.
Yeah.
Great, thanks. Okay, so other than the renal failure and the hypertension, do you have any other medical problems that we should know about?
Well, I've had 2 heart attacks.
Okay.
I had bypass surgery in 2002.
Okay. When was your last dialysis?
3 days ago. I've got one of those catheters.
Quentin catheter?
Yes.
Okay.
Yes.
Another interesting patient. He does not need to be immediately rushed back to the treatment area. He does not require immediate life-saving interventions. He is not an ESI level 1. However, he is a high-risk patient. The concern is his significant medical history that includes chronic renal failure, hypertension, and significant cardiac disease, combined with his presenting complaint of feeling weak. There are several questions the triage nurse cannot answer at triage. Is his potassium markedly elevated? Is he having another MI? What does his EKG look like? These are major concerns that warrant assigning this patient to ESI level 2. He is high risk, and it would not be safe for him to wait in the waiting room. I would give him my last bed. This patient meets the criteria for ESI level 2.
So, do any of you think he looks a little bit too good to be this dialysis patient and giving him a level 2?
What do you mean by too good?
Well, does he look pretty okay? He looks pretty good to me, really.
Well, except that you have to consider he's chronically ill. So, you know, a lot of what he's experienced before. So, you know, it may be usual to him in some ways. I mean, one thing that came to me right away, I don't think they do it in that ER that they were showing there, but we do EKGs in our triage area. That would be something he could get in our triage area that would right away tell you if there was anything going on cardiac at that moment.
Okay, but would you get an EKG before you assign a triage category? Or would the triage category kind of dictate the fact that you need to get that EKG?
Well, yeah, you'd go ahead and assign him a category. However, as an adjunct along with all the other information you're gathering, an EKG could be part of that.
Right. And that's a good point, because a lot of people are doing more and more at triage now. But I think you still are going to have to make a decision on the triage category before you have any other interventions or do anything else. And I think he just looks pretty good, but it's important to remember he's high risk, he's due for that dialysis patient, and all those things that we talked about. He's dizzy, he's having chest pain. You really don't have any idea.
Right.
So if you did his EKG, then that's sort of a process thing afterwards. But you're still not going to know his potassium level, so I wouldn't still change him. Yeah.
Don't you see all these patients with weakness coming in with that chief complaint? And I think the thing the triage nurse has to do is sort out what are the, what I will call high-risk situations. You know, is he a diabetic? I mean, this particular gentleman told you he was a renal patient, but, what is his history? It could be so many different things, and many of these are high-risk patients because they have chronic medical problems.
And many of them don't have the classic symptoms, even if they're having a heart attack. If they've had an incision in their chest or if they're diabetic, sometimes they won't have classic chest pain as a presenting complaint.
That's an excellent point.
And in a lot of ways, I consider it like a puzzle. I mean, he starts out with the dizzy weakness part. Well, then he adds the dialysis part, then he adds a hypertension part, then he had 2 MIs, and you're like adding all these pieces to the puzzle, and they're giving you a picture.
And because of that history, especially, I would make a room for him. I know you mentioned on the video that you would give him your last bed, but even if the bed was not available, I would have to pull somebody that was more stable and put him in before I do that, because he's weak. I saw him walking with a cane to you. I would go ahead and get a wheelchair or a stretcher to push him back into the treatment area. That's what I would do.
Great.
Excellent points on this case.
Yeah, if he was a level 2, he was very, very up there and upwards of level 2.
Well, that's a good point too. What if you had 5 level 2s now? What if you had, we could do a little prioritization of 2s. So you have somebody now with, let's put that subarachnoid that we talked about with a headache, female with severe headache after a bowel movement that we're thinking is a subarachnoid. And then you have this patient with dialysis. And then you have somebody who has chest pain and some shortness of breath. So who would you want to put first?
I certainly want to do the EKGs to see if I saw
Right.
anything.
Don't have that at this institution.
I get
Too
the
bad.
pulse ox on the shortness of breath and pulse ox on the
That's a
dizzy.
good idea.
On the dizzy guy.
I think what you need to look at is who's requiring intervention immediately. And so that would be one telltale in terms of a life-saving intervention is the pulse ox.
Well, let's say that we have none,
Yeah,
and that's
pulse
absolutely
ox
true, no level 1 criteria for any of these patients. So you have 3 level 2s. Chest pain, short of breath, this man who's weak and dizzy on dialysis, and you're maybe subarachnoid.
I'd have a hard time between the chest pain, short of breath, and the subarachnoid.
Gotta have to see him, but
Right.
let's say that, this chest pain doesn't look very good.
That's what I was going to say.
Not looking good.
The subarachnoid, we'd want to get her back, but she looked good at that moment.
Right.
But again, we don't have the information on the shorter breath chest pain, but things like how he looked physically. Is he diaphoretic?
Yeah, let's
What's his color like? What's his age group? Any past history? Any factors that are making us think heart?
Right.
I think what Paul is saying, part of it is you're basing your judgment on your across-the-room assessment as well as
Yes.
that information you gathered during your triage assessment, and really figuring out who's the sickest, who really needs to go back first, and who can safely wait for a few minutes until another bed becomes available. In this era of ED overcrowding, finding beds is becoming increasingly more difficult. And I really liked your point about pulling somebody out of a room into the hallway and creating a bed.
Yes.
Because you're going to face this situation all the time. And you still do that, and people ask us that question a lot, too. So just because you have 5 levels, within those levels, you're still going to have to prioritize your 2s, and you're still going to have to prioritize your 3s. So time ordering your chart according to category is just not a good idea. So you're still going to have to do a lot of assessment. Great.